Hello ladies and gentlemen. So today, our group is going to talk about STD and oral diseases. So first of all, what is STD? STD, which is also known as sexually transmitted diseases, are infections that are passed from one person to another through sexual contact. The contact is usually vaginal, oral, and could also be anal sex. There are actually more than 20 types of STDs, but today we are going to discuss 6 of the STDs that can be caused by bacteria, viruses, and parasites. The first STD that we are going to discuss about is Chlamydia. Chlamydia is one of the most common bacterial sexual transmitted infections in the US. It can occur among all age groups, and it is caused by Chlamydia trachomatis. So a person can get chlamydia when their mucous membranes, such as those that has been listed, the throat, the genitals, the urinary tract, and the rectum come in contact with chlamydia bacteria. The bacteria will enter the mucous membrane and multiply there. The most common way to spread chlamydia is through unprotected anal or vaginal sex. It is possible that chlamydia can be transmitted to your throat if you give oral sex to a partner who has been contacted to a genital chlamydia infection. Just like what we have stated in the previous slides, chlamydia in the throat only cause minor symptoms or sometimes no symptoms at all. So some people with chlamydia infection at the throat may only have a sore or a swollen throat and think that it is due to common cold or flu virus. One of the ways to diagnose chlamydia is by getting a fluid sample by using a cotton swab. The physician can also conduct a pharyngeal chlamydia screening if the patient had a sore throat that doesn't seem to go away, or if the patient had an oral sex with a person who has been tested positive for chlamydia. The treatment for chlamydia infections are just like the one that have been listed on the slides. The patient will be prescribed with antibiotics that may last for 1 to 7 days. So next, we are going to talk about gonorrhea. Oral gonorrhea is a rare and non-specific type of STD. It is an infection of the pharynx with gram-negative cockle-shaped bacteria named Neisseria gonorrhea. It is acquired through direct contact with a white or yellowish pus-like fluid termed as discharge containing the bacteria from one sex partner. The symptoms may vary and may range from slight erythema to severe ulcerations with pseudomembranous coating. However, the most common symptoms are sore throat, burning in the throat, and throat that resembles a strep throat with redness and occasionally may have some white or yellowish discharge. As you can see from the picture with the black arrow, the soft palate is erythematous and have multiple whitish yellowish discharge on the soft palate. The diagnosis of gonorrhea can be done by conducting rapid throat swab, which is designed to detect gonorrhea. Besides that, we can also do gonococcal cultures, which attempt to grow the gonorrhea bacteria from the swabs taken from the sites of potential infections. Gonorrhea infections can be transmitted in many ways, such as those that has been stated on the slides. The pathogenesis of the infection includes the attachment of the bacteria on the epithelial cells, and after that it will infect the mucosal surfaces, it will alter the surface structures, and lastly it will evade the host immune response. CDC recommends that the treatment for gonorrhea includes ceftriaxone 250 mg IM plus with a single dose of azithromycin 1 gram orally. But many people that develop oral gonorrhea never exhibit any symptoms and spontaneously clear the infections without any antibiotics. This is a case control study of 245 young men and women between April 2012 and May 2014, where they examined the proportions of missed infections and correlates of pharyngeal gonorrhea among young people who attend public STD clinics. It is found that factors independently associated with pharyngeal gonorrhea includes the number of oral sex partners, the level of oral exposure to vaginal or seminal fluids, and a contaminant urogenital infections with gonorrhea. All study participants were tested for pharyngeal gonorrhea and urogenital chlamydia and gonorrhea. The test is known as NAAT, where the testing detects the genetic material of gonorrhea bacteria and is considered as the optimal test for gonorrhea infection. This type of test can be performed on a urine sample or a swab taken from a site of potential infection.
Next, the third disease is syphilis. What is syphilis? It is a sexually transmitted infection that is caused by a type of bacteria known as Treponema pallidum. Syphilis can be transmitted via sexually or from mother to fetus. It can affect mouth, lips, genitals, anus, and rectum. If not treated, syphilis can also spread to affect other parts of the body, including blood vessels and nervous system. Syphilis symptoms occur in stage in which the first stage called primary syphilis. It is characterized by painless sore or ulcer or chancre inside the mouth, on lip, tongue, genitals, rectum, and the sore will disappear on its own without treatment. Picture on the upper right showing syphilis chancre of the mouth. In the second stage or secondary syphilis, they may experience a skin rash, swollen lymph nodes, and fever. The latent stage of this condition, which can last 4 years, shows no sign or symptoms. The third stage or tertiary syphilis, patient might have palliative fistula resulting in gamma. So gamma is a soft tumor-like growth of the tissues that occur in people with tertiary syphilis. It can also affect brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. Congenital form of syphilis, patient will have Hutchinson teeth and also mulberry molars. This can occur when a pregnant mother transmits syphilis to her child in utero or at birth. Next, the picture on the lower left showing palatal fistula that occur in tertiary syphilis, and next to it showing mulberry molars and also Hutchinson teeth that occur in congenital syphilis. So how to diagnose syphilis is by simply observing a chancre, but it is not enough for a diagnosis. A doctor or dentist will need to draw blood or take a fluid sample from the sore for further testing. Rapid plasma reagent (RPR) is a syphilis blood test to test antibodies to syphilis bacteria. We also can do the biopsy of tissue and also fluid from the sore. So how to treat syphilis is oral syphilis is highly treatable in its early stage. The standard treatment for most oral syphilis is antibiotic benzathine penicillin G. A single intramuscular injection of long-acting benzathine penicillin G will cure a person who has primary, secondary, or early latent syphilis. In late latent or unknown duration of syphilis, dose of the antibiotic will be the same but requires multiple injection. Treatment will kill the syphilis bacterium and prevent further damage, but it will not repair the damage that has already done. Next is herpes simplex viral disease that is caused by HSV1 and HSV2. So herpes simplex, it can be transmitted by sexual contact, saliva, auto-inoculation during pregnancy and also labor. It can be diagnosed with IF staining, PCR zinc smears, and direct fluorescent antigen. Picture on the upper right showing herpes labialis, in which it is the most common manifestation of recurrent HSV infection that may last up to 5 days and occur in most patients less than twice per year. The sign of this herpes labialis is the patient might have erythematous papules rapidly develop into tiny vesicles that eventually ulcerate, and this might cause the patient feel pain, burning, and also tingling on the site prior to the papule formation. Picture on the below showing acute herpetic gingivostomatitis. This primarily seen in younger patients, 6 months up to 5 years, but may occur more acutely and less severely in adults. It abrupt onset and lasting 5 to 7 days. Sign of this acute herpetic gingivostomatitis, the patient might have high temperature between 102 and 104 Fahrenheit or 38.9 up to 40 degrees Celsius. And the patient might have anorexia and also feeling laziness or lack of energy. And next is acute herpetic pharyngotonsillitis that more often in adults. The sign of this is the oral and labial lesion occur, but it occur in less than 10% of the patient. Ruptured vesicles may rupture and also form ulcerated lesion with grey exudates in the tonsil and posterior pharynx. The patient also might have fever. Symptoms of this infection is malaise, headache, and also sore throat. Next is the difference between HSV1 and also HSV2. HSV1 traditionally associated with orophacial disease, but in HSV2 it is with genital disease. In HSV1, it reactivates more frequently in the oral region, but in HSV2 reactivates 8 to 10 times more frequently in the genital region and also than the aerolabial. In HSV1, It is usually acquired in childhood and also transmitted chiefly by contact with infected saliva, while in HSV2, it presents maybe an indirect measure of sexual activity in some cases and also transmitted sexually or from a mother genital tract infection to her newborn. Complication from this infection, it might have bacterial and also fungal superinfection, ocular, skin and visceral infection, CNS involvement, pregnancy and neonatal complication, and also increased risk of HIV infection. Next, this case study showing case on herpes gingival stomatitis and herpes labialis that is caused by HSV1. This study focused on the clinical features of the HSV infection and the important psychological implication. As in oral manifestation, patient might have cold sores that can cause small blister placed in groups and also sore throat. The first episode usually more severe and may be associated with fever, muscle pain, swollen lymph nodes and also headache. The picture on the right showing herpes gingival stomatitis. It is often the initial presentation that occurs during the first herpes infection, and the picture below showing herpes labialis that the infection occurs when the virus comes into contact with the oral mucosa or embedded skin.
So we move on to the next sexual transmitted diseases that is caused by HPV. HPV is one of the most common causes of reactive neoplasms. This includes squamous cell papilloma, verruca vulgaris, condylarthrioma acuminatum, and focal epithelial hyperplasia. The first reactive neoplasm that is caused by HPV is squamous cell papilloma. It is commonly due to HPV of subtype 6 and 11 with unknown mode of transmission. It usually infected tongue, lip, and palate among children at any age. The second neoplasm caused by HPV is verruca vulgaris, also known as common wart. It is a group of HPV subtypes 2, 3, 6, and 40 and transmitted through autoinoculation. This verruca vulgaris commonly happen at the mammalian border, labial mucosa, and anterior tongue among children, especially in the middle age. The third one is condylarthrioma acuminatum, also known as venereal wart. It is commonly caused by HPV of subtypes 2, 6, 11, 53, 54, 16, and 18. It is sexually transmitted and commonly infected labial mucosa, lingophrenium, and soft palate. Young adults have the highest chances to be infected by this neoplasm. The fourth one is focal epithelial neoplasm, also known as Herpes disease. It is usually caused by HPV of subtypes 13 and 32 and mostly infect labial mucosa, lingophrenium, and soft palate. This Herpes disease commonly occur among young and middle-aged children. So this is the clinical features that can be observed. Squamous cell papilloma can be seen as esophageal, papular, and finger-like projection with white or normal color of mucosa, while verruca vulgaris is seen as papule or nodule with papillary projections with pink, yellow, white color. It is rapidly enlarged to maximum size of less than 5 mm. The third one is condylarthrioma acuminatum, which shows sessile pink, well-demarcated esophageal mass and short, blunted surface projections that is larger than papilloma, which is around 1 to 1.5 cm. Lastly, focal epithelial hyperplasia can be seen as multiple soft, non-tender, flattened or round papules, can be scattered, pale, and small, which is around 0.3 to 1 cm. And this is treatment for each of the reactive neoplasms caused by HPV. The first one, which is squamous cell papilloma, the treatment includes surgical removal. As for verruca vulgaris, the treatment is topical cytotoxic agents, electrocauterization, electrodesiccation, curettage, lasers, and surgery. As for condylarthrioma acuminatum, the treatment includes topical cytotoxic agents, topical and systemic immunomodulators, cryotherapy, electrocauterization, electrodesiccation, curettage, lasers, and surgery. As for focal epithelial hyperplasia, the treatment includes cryotherapy, electrocoagulation, treatment with carbon dioxide laser, systemic treatment with interferon alpha, topical treatment of interferon beta, retinoic acid curettage, lasers, and surgery. Now, we move on to the last transmitted diseases that is related to oral disease, which is HIV. HIV is a virus that damages the immune system, which affects and kills CD4 cells, which are a type of immune cells called T cell. HIV is transmitted through bodily fluids that includes blood, semen, vaginal and rectal fluids, and breast milk. According to the CDC trusted source, it is most commonly spread through vaginal and anal sex.
However, risk of spreading HIV through oral sites is extremely low. The virus is not transferred in the air or water or through casual contact. The symptoms of HIV is fever, chill, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcer. HIV doesn't have any drugs that can eliminate it from the body. However, HIV is possibly to be managed and live with it for many years by consuming antiretroviral. Without treatment, a person with HIV is likely to develop a serious condition called acquired immunodeficiency syndrome, known as AIDS. At that point, the immune system is too weak to successfully respond against other diseases, infections, and conditions. So there are a few oral diseases in HIV infections, such as candidiasis, hairy leukoplakia, Kaposi sarcoma, HPV-associated warts, and periodontal diseases. The first one, oral candidiasis, also known as oral thrush, occurs in the mouth. Oral candidiasis is a yeast or fungal infection of Candida species on the mucous membrane of the mouth. Candida albicans is the most commonly implicated organisms in this condition. Candidiasis will appear as white patches on their inner cheeks, tongue, roof of the mouth, and throat. So this photo shows candidiasis in the mouth and cotton-like feeling in the mouth. The second one is hairy leukoplakia, where there are white patches on the side of the tongue with a corrugated or hairy appearance. It is caused by EBV and occurs usually in the person who are immunocompromised, especially those are HIV or AIDS. The third one is Kaposi sarcoma. Kaposi sarcoma is a type of cancer in which patches of abnormal tissue grow under the skin or mucous membrane in the mouth, nose, and anus. The cancer can also involve the lung, GI tract, and other organs. Kaposi sarcoma tumors usually manifest as bluish red or purple bumps. Kaposi sarcoma involving the oral cavity is a feature most commonly seen in AIDS-related disease. Human papillomavirus-associated warts can also occur, such as Burka vulgaris and Cordula acuminatum that has already been mentioned in previous slides. Last but not least, periodontal diseases can also associated with HIV infection and usually presented as linear gingival erythema, necrotizing ulcerative gingivitis, or necrotizing ulcerative periodontitis. I think that's all from our group covering STD and oral diseases. With that, thank you.